Today, let's discuss about one of the most important topic in the forensic toxicology, that is the phosphorus poisoning. We know that phosphorus is of two forms, that is red and white phosphorus. Commercially, we will use this phosphorus for making insecticide and rodenticides, and also we will use this phosphorus in a fireworks and also in the manufacturing of these fertilizers and also in the preparation or the explosives of these bombs. And let's discuss about this forms in a detail. First one is the yellow phosphorus, also known as a white phosphorus. When this phosphorus is exposed to air, this phosphorus gives a fumes of phosphorus peroxide which have a garlic like odor. Remember, garlic like odor. This when a person is taking this phosphorus poisoning after a post-mortem or during a post-mortem, and also from a mouth of this patient we will see this peculiar garlic like odor. When this phosphorus get exposed to this air, this phosphorus gives a phosphorus peroxide. This phosphorus peroxide is having an garlic like odor, and this is also luminous in a dark. And it also important point, that is first they will be having a garlic like odor and also luminous in the dark, and this fumes glow with pale yellow color. Important, pale yellow color. First one is we discussed, that is garlic like odor they are having, and next is they will be having an luminous property, and third one is they glow with pale yellow color, and next one is the red phosphorus. And when the white or yellow phosphorus is a heat at 240 to 250 degrees Celsius, then it has no taste, no smell, or any luminescence is not present. So, the red phosphorus in its pure form, means without adding any adulterants, the red phosphorus is very pure, in very pure form, is non toxic. Okay, when this red phosphorus contain yellow phosphorus about 0.6%, then it will become poisonous. First, this red poisonous in its pure form is non-toxic, whereas this red phosphorus combines with the yellow phosphorus for about 0.6%, then this pure one get converted into an a toxic poison. And let's see the mode of action of the poison. This phosphorus is converted into an hydrophosphorus and phosphorus acid in the body, and it will show a protoplasmic poison. Means this phosphorus is an protoplasmic poison. First, it will affect the cellular metabolism. When this phosphorus enter into our body, during poisoning, first it will affect the cellular metabolism, and this cellular metabolism causes the anoxia in our body. And then second, it disturbs the carbohydrate. First one, it will disturb cellular metabolism. Next, it will disturb carbohydrate, fat, and protein metabolism. Next, slowly it will impair the blood circulation, and then it will interfere with the bone growth, and then leading to a necrosis in case of chronic exposure. First, we learned that when it will enter into our body, it will causes an it will affect, first it will affect the cellular metabolism and then leads to anorexia. Then it will disturb carbohydrate, protein, and fat metabolism, and slowly it will impair the blood circulation, and then it will interferes with the bone growth, and this bone growth, when it get interfered, then it leads to a necrosis. And this is mainly seen in case of chronic poisoning. And let's see, fatal dose is about 60 to 120 milligrams micro mg, and fatal period is about 2 to 8 days. And let's see signs and symptoms of there is mainly three types of poisoning: fulminating poisoning, acute poisoning, and chronic poisoning. Chronic poisoning is the most important we should study. First, let's see about fulminating poisoning. Fulminating poisoning means when we took this phosphorus, about more than 1 gram is taken, and usually they will die within 12 hours due to shock and the cardiovascular collapse. If they will ask in exam, what is the reason of the death in the phosphorus poisoning is, in case of fulminating poisoning, it is due to shock and cardiovascular collapse, because this phosphorus is having a direct action on our heart and blood vessels. First we studied that it will dearrange cellular metabolism, carbohydrate, fat, protein. Next it will impair our blood circulatory system. So this phosphorus is having a direct action on the heart and blood vessels, so they will experience a shock and the cardiovascular collapse, and the death usually occurs within a 12 hours after taking a poisoning. This is the fulminating poisoning. And let's see about acute phosphorus poisoning. Acute phosphorus poisoning, we will see a three stages. A first stage is a signs of irritations. First stage we will see normally in a after 1 to 2 days after poisoning. First they will be having a signs of irritation will be there, extreme thirst will be there, and they will be having an vomiters and stool. We studied that phosphorus is having a garlic like odor, so the vomiters and the stools will be having an garlic odor. And also they are luminous in the dark, which is the diagnostic feature of this phosphorus poisoning, which we already studied in that first part, that is when we are discussing about a red phosphorus, white and yellow phosphorus. We said that when they get exposed to air, they get converted into an phosphorus peroxide, so it will give an garlic like odor, and which are luminescent in dark and also have a pale yellow. We all discussed in a first part. Let's see if you want check once. And now in the first stage they will be having vomiters and the stool will be having an garlic odor and also luminous in the dark, which is the diagnostic feature of this phosphorus poisoning. And also the fumes, faint fumes will arises from a stool, that is called smoky stool syndrome. Important, in case of phosphorus poisoning we will see a smoky stool syndrome, means a faint fumes arises from the stool. And also when the phosphorus get contact with our skin, it will produce a primary and the secondary burns, and these burns are painful, and this phase may be severe and also may cause to a death of a victim because of the shock. And second phase, first phase we till now we are seeing first phase. Okay, now second phase, during second phase there is no particular symptoms, means this phase is symptom free and last for about 2 to 3 days. First one is about 1 to 2 days and this is about 2 to 3 days. And the third phase is the stage of systemic toxicity. Here is the where the original symptoms of this phosphorus poisoning starts. It is characterized by abdominal distension will be there, jaundice they will be having, and shrinkage of a liver will be seen with acute yellow atrophy. Okay, they will be having a shrinkage of the liver because of an acute yellow atrophy. Okay, and fourth one is they will be having an hypoprothrombinemia, and they will be having an purpura, epistaxis, anemia will be there, and they will be having an a general weakness of the body will be present. And next one is CNS. In case of CNS, they will be having an pain in the frontal region and insomnia. Insomnia means unable to sleep during night time, and they will be having an ringing sound in the ears, and the vision is also impaired. They will be having an paralysis, cramps, delirium, coma will be there, and normally death is due to hepatic and the renal insufficiency, or maybe CNS failure, or maybe respiratory. First, we studied in a fulminant poisoning. It is due to a shock or the cardiovascular problem. Death is due to shock or cardiovascular. Whereas in case of this acute poisoning, death is due to hepatic or the renal insufficiency. And the treatment, what can we do in this acute poisoning? Acute poisoning of phosphorus. First one, we will provide some life supporting measures, airway maintenance, fluid maintenance should be provided. And we will give dextrins, calcium gluconate, activated charcoal, vitamin K, peritoneal or the hemodialysis if required we can provide. And we can do a gastric lavage with the potassium magnesium with KMNO4 and the CuSO4, and general measures and symptomatic treatment we can do. And post-mortem appearance is that when death takes place within a first 24 hours, then generally they will be having it generally it is an highly irritant poisoning, and it consists of inflammation of this mucosa of this pharynx, esophagus, stomach and intestine we will see. And also cloudy swollen liver and kidneys we will see. And also contents of this bowel and the kidney, contents of the stomach and the bowel is luminescence in the dark. We already studied that luminescence is the diagnostic feature of this phosphorus poisoning. And also the body show a strong smelling of this garlic. And this color of this post-mortem staining may be dark brown or the yellow color. And this is the most important, most important is that chronic poison we should learn, and they will ask for exam. Chronic poisoning reason, what is the reason means due to inhalation of these fumes for a long period of time. Okay, because of inhalation of these fumes for a long period of time, it may lead to an chronic poisoning. First, they will show nausea, vomiting, anorexia, pain in the stomach, indigestion, pain in the joints, loss of weight will be there, bronchitis, jaundice, and anemia. These are the most prominent symptoms we are seeing. And next one is the phossy jaw. Important, phossy jaw. In this condition, they will be having an osteomyelitis and the necrosis of the jaw will occur. In this condition, what? Osteomyelitis and the necrosis is most commonly seen. First, where it will start. This uh, Fossils starts in the place where there is a decayed teeth in the lower jaw. First, it will start in the region of an decayed teeth in the lower jaw, and that they will be having an toothache, which is followed by the swelling of this overall lower jaw, and then they will be having a loosening of the teeth, and then necrosis of the gums will be there, sequestration of the bone in the mandible will be there, and multiple sinus discharging foul smelling pus will be there. That is the most important. Let's see again, what is jaw. In this condition, osteomyelitis and the necrosis of the jaw occur. First, it will start in the region of an decayed teeth in the lower jaw, and toothache is followed by a swelling of that jaw, loosening of this teeth, and then necrosis of the gum and sequestration of the bone in the mandible. And there will be a multiple sinuses with an foul smelling pus, and the affected bone will glow with a greenish white color in the dark. And this full-fledged osteomyelitis will occur within 2 to 5 years in case of chronic poisoning. And what treatment we will give in case of chronic poisoning include regular mouthwash we will do with the help of sodium bicarbonate is mainly advised. And we can do x-ray for the early detection of this bone necrosis. And if any tooth decay is there, we should immediately send them for filling of this cavity. And any decayed tooth is there, they can extraction of that decayed tooth should be done, and surgical removal of that affected bone so that we can avoid a systemic effect. And what are the preventive measures we can do? Preventive measures include a ventilation. We should have a correct ventilation in this working place. Phosphorus, any industries, so that these fumes will go outside. We can avoid that much contact with that fumes. And what are the medical legal importance of this poisoning important? Normally for we can use for suicide. Phosphorus is widely used in rodenticides and insecticides so that they can useful for this suicidal purpose. And in homicide is rare, but it may be given with a liquor to mask the smell and taste of this poisoning. Mm, and then let's see, they will be having an accidental poisoning. Accidental, normally we will see when the infant who used to lick the match boxes, and these match boxes consist of an yellow poisoning. In that cases they may be having an accidental poisoning. And also cases of poisoning may be occurred during a war. And arson, what is arson? It is important that white phosphorus. Now we studied that two types of phosphorus is there, red and white. We will take this white phosphorus when it is covered with a dung, and or they wet cloth is thrown on after when they will dung covered with the dung, and they will make it wet, and then they will throw this into an hearse with an, so that after when they will become dry, this wet cloth become dry, and that this roof catches the fire. In case of some revenge, maybe they may do. I think phosphorus poisoning is clear, and thank you for listening.